Hey everybody, it's Dr. Paul Thomas.
And Dr. Raquel Orlick.
And we're with Plum Health DPC, and we're doing a coronavirus update for Wednesday, April 22nd. And unfortunately, there was another big jump in the number of cases and the number of deaths reported in Michigan. We're now close to 33,000 total confirmed cases and 2,700 deaths. Yesterday, there were, I think it was like 50 or 70 new deaths. And so there's quite a big jump. And I'm wondering if this has something to do with the number of uncounted deaths at the DMC. I know there was a report of like bodies building up in the morgue there. So perhaps they've gone through and categorized those people who have died. So hopefully we continue a downward trend, but that was definitely something that caught us off guard, seeing that number of deaths today. But what we're doing right now in terms of public policy is working. The stay-at-home orders, wearing masks like we're wearing, has reduced the rate of transmission. And this is the count of confirmed COVID-19 cases by date of onset. So our researchers in Michigan, epidemiologists, are looking at the number of new cases. And we saw a really big spike at the end of March and at the beginning of April. But now as we've gone later in the month of April, we've seen things taper off, which is a really good sign. The other thing I wanted to point out is that the number of cumulative cases is increasing, but it's looking like it's starting to taper off a little bit. It's not a exponential growth like it was early in the process of coronavirus affecting us in Michigan. Now we're starting to see things taper off gradually, which is really encouraging. So whatever you're doing at home, by staying at home, only going to the grocery store once a week, washing your hands thoroughly, wearing masks when you're in public, all those things are starting to pay off. So thank you for what you've been doing. I'm here with Dr. Raquel today because we're going to talk about vaccines and basically how they work and what's the implication for coronavirus. So maybe Dr. Raquel, you could give an overview of how vaccines work.
Sure. So vaccines, when we are administering a vaccine to a patient, we are giving a mixture of, usually it's the weakened virus or the virus is already killed. So the lab has made basically the external structure of the virus without giving any of the potential dangerous portions of the inside of the actual part that makes you sick. So when we introduce that to the body, our immune systems recognize that and will build antibodies against that virus. So then, therefore, in the future, if you're actually exposed to the real virus, your body is already prepared for this, and they have this response to then immediately go after the either virus or bacteria and kill it immediately.
Yeah, so a great overview. And so in this case, how is a vaccine going to be helpful for us in terms of the coronavirus?
Yeah, so of course this is a new virus, so we don't know exactly what's going to happen after this year. Medical experts do predict that this might be one of the reoccurring viruses, such as the flu, where we do need to develop vaccines every year. So the hope is that we develop a vaccine that will be prepared better for next year. So then that way we can initially prevent the virus and we'll have better outcomes, and then hopefully people won't get sick like we did this year.
Sure. So there's 10 million, 9 million Michigan residents, and so far we've only had 33,000 confirmed COVID cases. How many other cases do you think are out there? How many cases of coronavirus have happened? How many people have gotten coronavirus who we haven't been able to count with testing?
I imagine, at least, I would say anecdotally, because we talk to a lot of our patients. We don't see them in person very often as much at this time, but we don't recommend necessarily for our patients to go out and get tested. We do a lot of times, if they're telling us that they're having a lot of the symptoms that seem similar to the COVID-19, so the body aches and the cough and the shortness of breath, a lot of our patients, we're asking them to quarantine at home to protect themselves, to protect family members, just to help them continue to rest and stay at home. So there's a lot of people that are potentially infected with the virus that we're not able to account for. Not only that, but a lot of people may also be asymptomatic carriers.
Yeah, they're saying maybe 25% to 50% of people who get the coronavirus are asymptomatic carriers. So it could be, on top of these some 30,000 cases that are confirmed, there might be another, 100,000 or 200,000 people who've been affected and not had symptoms severe enough to warrant testing.
Right.
So there's a lot of vaccines that have been developed in the past to help us deal with other infectious diseases. Can you talk about how they're important and why that's important to know?
Yeah. So coronavirus isn't the first virus or bacterial infection that our country has been exposed to that has caused quite a bit of illness in the past. For instance, before the polio virus was developed, even in the U.S., a lot of people were stricken with the virus. For instance, if you look from the table here, close to 15,000 people were affected annually by the polio virus. Now, most people are getting the polio vaccine during their childhood vaccines. We're getting close to somewhere around zero of any type of exposure here. Now, definitely it's still an issue in third world countries, but in the U.S., luckily we have seen that close to zero. But if you can see from the diagram here, we've had a lot of our childhood vaccines that we do administer for our young kiddos have almost been completely eradicated from the U.S.
Right, and that's why that childhood vaccine series is so important because, let's say before the polio vaccine is developed, there's 16,000 people who die every year from that alone, from polio alone, and now we have zero deaths from that. So hopefully once we develop the coronavirus vaccine, we'll have a similar rate of decrease where we can really eliminate any deaths, unnecessary deaths, because we have a vaccine that's effective. So the last thing you wanted to talk about was herd immunity, right? And so what's this concept of herd immunity and why is it important?
So herd immunity is a term given where if a certain community is affected by a virus or an infection, essentially when there's enough people who are either affected by the virus or vaccinated or to be protected against a virus, the concept of herd immunity is that the individuals that can't get vaccinated for whatever reason or are immunocompromised, we're looking to keep them protected, because if everybody around them is either immune through vaccination or has been exposed in the past, then that individual hopefully cannot be affected.
Great, yeah. And I think this is super important when you're talking about things like measles, mumps, rubella, polio, and now influenza virus, the annual flu, or coronavirus. The more people who have been infected and recovered, or the more people who get the vaccine, we can potentially help others protect themselves, especially those who are immunocompromised who wouldn't otherwise be able to get the vaccine on their own.
Exactly.
All right, so that's our update for today. Hope everybody's doing really well. I know this has been a really trying time, especially here in Michigan. Just the snow over the past few days has been crazy. So hopefully everybody's staying safe and in good spirits. Thanks so much for watching and have a great day.